Complementary and alternative medicine, CAM, in the American adult population increased significantly during the 1990s and has continued at a relatively stable rate of 36 to 38% over the past 10 years. Acupuncture has attracted public attention as well as researchers' interest since it was introduced to the USA in the 1970s. The term acupuncture can be attributed with invoking impressions of simplicity and complexity. A sharp object, a needle, is simple, whereas the human body, its object, is complex. The fundamentals of acupuncture therapy view the needle as yang in its sharp, focused, metallic, and intrusive form. The body is yin, since it is comparatively soft, organic, expansive, and complex. Acupuncture is not only about the yang and yin of a needle and body. It's a system of ideas, understood relations, and practices that inform the health provider about every aspect of needle placement. The understanding of how acupuncture works has evolved with its practice, but the techniques set down 1,000 years ago have largely been retained. The main function of acupuncture is to regulate the circulation of blood and qi, which is vital energy. All the descriptions of acupuncture that are based on traditional model involve rectifying a disturbance in the flow of qi. If the qi circulation is corrected, the body can eliminate most symptoms and eventually, with proper diet, exercise, and other habits, overcome virtually all disease. Many individuals are surprised to learn that acupuncture is relatively painless. Unlike hypodermic needles, which are hollow and much larger, acupuncture needles can be as fine as human hair. Many times, a patient is not even aware a needle has been inserted, especially when it is placed in areas with relatively few sensory nerves, such as the back. In a standard acupuncture treatment, the patient lies down and the practitioner inserts needles in points that have the desired effect on the body. The patient senses heaviness, movement, or an electrical impulse that signals the arrival of qi. After a few minutes, the patient typically feels a sense of well-being and calmness. Some people even fall asleep. After a period of 20 minutes to an hour, the practitioner removes the needles and advises the patient to avoid strenuous activities for a few hours to let the therapy settle in. Depending on the individual and the condition, one treatment might be sufficient, or the patient may need to return a number of times. Results can range from mild improvement to seemingly miraculous recovery. In almost all cases, however, the patient feels calmer and more peaceful after receiving acupuncture. Results from several studies suggest that acupuncture may help ease types of pains that are often chronic, such as low back pain, neck pain, and osteoarthritis knee pain. It also may help decrease the frequency of tension headaches and prevent migraine headaches. Therefore, acupuncture appears to be a reasonable option for people with chronic pain to consider. However, clinical practice guidelines are inconsistent in recommendations about acupuncture. Current evidence suggests that many factors such as belief and expectation, both unrelated to acupuncture needling, may function as an important role in the positive effects of acupuncture on pain. Of integral nursing is an amalgamated theory developed by Barbara D'Arcy in 2008 and built largely on work of Wilber, whose integral theory outlined the four dimensions of all that is and represent what Wilber believed to be the true realities of life. The concepts that outline the organizing structure for the theory of integral nursing are healing, recognition of the meta paradigm of nursing, patterns of knowing, quadrants, and all quadrants/all levels. The core concept in the theory of integral nursing is healing and is conceptualized as a process that includes knowing, doing, and being as part of a lifelong voyage towards increasing personal harmony. The concept of healing is informed and transformed by the four dimensions of reality that exist at any moment, also known as quadrants. A, individual interior, personal intention, the I space. B, individual exterior, physiological, behavioral, the it space. C, collective interior, shared cultural, the we space, and D, collective exterior, which is systems and structures, the it space. For the purpose of demonstrating how effective this theory is when applied to acupuncture therapy, the individual interior and individual exterior would be the patient's desire to use acupuncture for pain despite conventional choices. The shared belief in this scenario is that both parties, patient and provider, want to eliminate or decrease pain, leaving the collective exterior to conventional and cultural standards of pain management. The meta paradigm of nursing involves the person, environment, health, and nursing. Within the theory, the integral nurse engages in care-related activities such as acupuncture therapy, which promotes patient wellness and creates a deeper, more meaningful connection with the divine, however interpreted or recognized. Integral person details how the patient interrelates with the nurse in ways that value and respect the life experiences of each member of the relationship. Integral health is the understanding that various types of health, such as mental, physical, emotional, and spiritual health, are not to be viewed as separate and equal, but as unique entities that create and frame the wholeness and stability of the metaphorical helix of health. Integral environment includes both internal and external aspects. The internal aspects of the environment relate to the patient's feelings and emotions, the meaning of events, and the way in which the patient enacts their understanding of caring and spirituality. The external environment involves things that can be objectively measured in the physical and social realms of reality, such as one's pulse and anything one can touch or observe scientifically in time and space. Fundamental ways of organizing nursing knowledge and nursing patterns of knowing involve 6 primary principles. These 6 patterns are superimposed on the quadrants of reality and work to bring nurses to the fullness of knowing and expression of being in each caring experience. Through the patterns of knowing, nurses are encouraged to develop a flow of ethical encounters through thinking and acting in ways that promote self-assessment and self-healing while generating a sacred space for care that promotes patient healing. When providers facilitate the use of acupuncture, they are acknowledging that this method is the patient's preference. This simple act can alleviate much stress associated with patients' decisions since it may not be the conventional choice. In this scenario, the patient is the personal principal. Acupuncture treatments would be categorized into empiric and not knowing principles, and the symptom of pain falls under aesthetic principles. Ethics and socio-political knowing principles involve how acupuncture therapy is not the first choice of treatment for pain and is not 100% fully understood by the provider. Quadrants in the theory of integral nursing can be understood as dimensions of reality that are penetrable, innately transforming, and empowering to all other quadrant experiences. Each quadrant is intricately connected and bound to each other quadrant, carrying along its own truths and language. Each quadrant provides a framework for interpreting the theory and is directed by 4 main principles as displayed on the slide. Healthcare providers who initiate acupuncture can utilize the information gained from this therapy and apply it to promote positive encounters. When facilitating the use of acupuncture, providers must be experienced in this field. Patients and providers can collaboratively create a plan of care that satisfies both parties. Acupuncture is needed for pain relief and is the preferred method from the patient point of view. Patient and provider will understand how pain relief is achieved. The final concept in the theory of integral nursing is all quadrants, all levels. Levels refer to the parts of the self that change over time and become permanent as one moves through stages of growth and development. Lines refer to the complex characteristics of self that enrich and enhance one's development. States refer to the temporary and changing forms of awareness, such as consciousness, unconsciousness, dreaming, waking, etc. Types refer to the differences in personality and expression that may dictate one's experiences of reality. Through the application of the dimensions of AQUAL, patients open themselves to insights about the complexity of the human experience towards acupuncture therapy and about the ongoing search for higher levels of consciousness that characterize the integral person and facilitate a sense of balance. Spiritual or compassionate care involves serving the person as a whole, encompassing the physical, emotional, social, and spiritual aspects of a human being. It is important to preserve and respect patients who incorporate spiritual and cultural beliefs into their healthcare because patients who are spiritual may utilize their beliefs in coping with illness, pain, and life stresses. Providing positive encounters with a patient's cultural and spiritual beliefs will also encourage patient self-empowerment and dignity. Some studies state that those who are spiritual tend to have a more positive outlook and a better quality of life. Fulfillment of life's goals, a meaningful personal existence, and a feeling that life to that point had been worthwhile, all correlated with a good quality of life for patients with advanced diseases, thus strengthening the statement that spiritual beliefs help patients cope with disease and face death. For patients seeking pain relief through acupuncture, I would recommend the additional task of establishing follow-up appointments. These follow-up visits will be vital in transcending care to optimal levels because patients will have the opportunity to express their satisfaction with the treatment and if they consider this to be effective. Communication is key when assessing pain management because it facilitates the transaction of important information that may be missed during the first initial contact. If patients feel their pain is not improving with acupuncture alone, I would recommend adding physical therapy as an adjunct to decreasing pain and improving range of motion. Many patients that suffer from pain engage in physical therapy exercises to increase functionality of debilitating movements. Acupuncture is outstanding at relieving pain and restoring normal sensation in the body, while physical therapy allows muscle and other soft tissue of the body to move more freely without restriction. Initiating acupuncture treatment for patients who desire this form of pain control comes with both positive and negative implications towards advanced nursing practices. Providers who facilitate this form of CAM can greatly increase patient satisfaction and reduce unnecessary costs involved with pain management. A study conducted in 2014 by the National Institutes of Health found that patients referred to acupuncture consult appeared to be satisfied with the current level of practice. These results were then used to launch a quality improvement plan that may be implemented to improve patient satisfaction with acupuncture practice. Researchers studied the cost effectiveness of acupuncture for lower back pain. Costs were measured from both National Health Services, NHS, and a societal viewpoint, with effectiveness being measured in terms of quality-adjusted life years gained, which is called QALY. Results showed that total NHS costs during the 2-year study period were higher on average for the acupuncture group, estimated at $859, than for the usual care group, which was estimated at $644. Although these findings proved to be costlier for patients seeking acupuncture, the cost per QALY gained was $7,921 compared to the lower threshold of $20,000 used by the National Institutes for Health and Clinical Excellence. A short course of traditional acupuncture for the treatment of lower back pain in primary care demonstrates a modest health benefit measured in QALY for a relatively minor extra NHS cost relative to usual primary care. In addition, an increasing number of insurance companies cover acupuncture costs, as research shows this is an advantageous benefit for pain control. The use of acupuncture for the treatment of lower back pain therefore appears to be cost-effective in longer term. Although there are many benefits towards integrating this form of care, issues continue to surface with the widespread popularity of CAM and acupuncture therapy. It has been noted that attention to the existence of both a knowledge and a communication gap for healthcare providers can cause misinformation for patients seeking counsel with acupuncture treatment. A lack of evidence-based information about safety, efficacy, and drug interactions with CAM therapies, as well as lack of proper training, is thought to be responsible for this deficit. It is important that professional standards regarding CAM be issued for pharmacists and healthcare providers as a vital source of guidance in providing patient counseling and utilizing these treatments.